7D of the Act of 2021. This meeting is of the Budget and Finance Committee. It's being conducted via remote participation and not in-person attendance or member of the public will be permitted, but every effort will be made to ensure the public can adequately access the proceeding on providing as provided for this order. As a reminding that persons who would like to listen or view this meeting while in progress might do so on one of the following access locations: the Facebook Lawrence City Council page, as well as the YouTube Lawrence City Council page. Councilors that are present today, we have Councilor at Large, Joel Payano, and Councilor District D, Dave Abdu. Dave, at this point, myself, Giovanni Rodriguez, at this point, if you want to take over the meeting, that's not an issue whatsoever.
Doing a great job. I'm rank and file. Keep going.
All right. We're just going to have a moment of silence for what happened 3 years ago in the city of Lawrence, the explosion of the Columbia gas. And we don't want this to be forgotten. So please join me for a moment of silence. All right. Thank you, councilors. So pursuant with our agenda, we have no minutes to be approved. We have item 18921, which is the order to spend grant funds mass in motion from the Department of Public Health is for the amount of $50,000. Alicia Miller, coordinator of the Mayor Health Desk, is supposed to be here, but if we have any representation from the Mayor Task Force, that will be appreciated. A quick explanation as of well, how we're going to be using this money.
Hi, my apologies. I oversee the Mayor's Health Task Force, but I wasn't aware of this being on the agenda for today. Alicia Miller is not here. I could text her to see if she could log in, if we can move on. If she can't, then I'll try to get some information so I can give you the information you need.
All right, so we're gonna, can I get a motion to table item 18921?
Motion to table.
Second.
All right, we call the roll call. Councilor Payano,
Yes.
Councilor Abdu,
Yes.
Councilor Levy,
Yes.
and I vote yes. Thank you. And then we're gonna move forward with item 19021, which is the order to expand grant funds, critical service to address COVID-19 emergency. It's for the amount of $600,000. Mike Amano from the Director of Special Services is here with us. So Mike, can you give us a quick explanation of this $600,000 that we're receiving today?
Thank you, councilors. Mike Amano, Director of Inspectional Services. Tonight, I come before you looking for the approval to expend grant funds for $600,000. This was money that was awarded to the city for a 2-year period of time, $300,000 till the end of this fiscal year and $300,000 for the next fiscal year. The purpose of the funds is to hire staff to help us with our case tracing and our investigations of communicable diseases, specifically COVID-19. So in the past, as many of you know, we used a lot of our regular staff, from clerks to inspectors to people in Health and Human Services, Mayor's Health Task Force, to start off doing case tracing. The importance of case tracing is, of course, to make sure that people are aware that they are positive for COVID-19 and that people have the support that they need to properly isolate so they're not out in the community spreading the disease, and also getting in touch with the contacts of these cases to let them know that they were close contacts and they could also be carrying the disease. So we facilitate testing. We had a great partnership with Health and Human Services to make sure that people had the food and other resources they needed to isolate and do what they had to do under the public health orders. So right now, as it stands, is a community tracing collaborative that was put into place by the governor that has been picking up a lot of the case tracing data work. And what we would be doing as a local municipality is continuing to make those initial calls and then going, basically picking up the work that the Commonwealth was doing with the Community Tracing Collaborative and entering this valuable information into the MAVEN system, the state's reporting system. I will pause if there's any questions about what this operation is or anything from the Board of Health.
All right, I have a question. So is the money, the intent of the money is to hire new people, like you said, or to pay overtime to the current employees we have in the city?
This is to hire new people.
Okay. All right, I have no more questions. Councilor, do you have any other questions regard to this $300,000 for this year, next year, $300,000 more?
Motion to send this to the full council favor recommendation.
Second.
All right, there is a motion on the table, properly second. We call the roll call. Councilor Payano,
Yes.
Councilor Abdu,
Yes.
Councilor Levy.
Yes.
All right, motion carries. Now we have item.
Councilor Rodriguez,
Yes,
Did you vote?
are you going to vote as well?
I vote yes. Thank you. We have item on the table matters, item 16921. We have Marta Velez here tonight. This item was tabled previously for some information that was missing. So can I get a motion to take item 16921?
Second.
All right, there is an item on the there's a motion on the table, properly second, and I call the roll call. Councilor Payano,
Yes.
Councilor Abdu,
Yes.
Councilor Levy,
Yes.
and I vote yes. Marta, you have the floor.
Thank you so much and good evening. First, let me say thank you for bringing this back up as a tabled matter. I did put it on the agenda. We were awarded this right before I left on vacation on July 27th. On actually July 30th, I got the email saying that we were awarded this money. So I spoke to Mark Ianello and said, can I put it on the agenda so then it could go to full council and I can appear in front of you when I came back from my vacation. Unfortunately, because of everything that's happened, when I came back from my vacation, I wasn't able to. So thank you for tabling it and thank you for having me today. So I'm excited to say that the city, through the Mayor's Health Task Force grant writers, received what was $1 million, but now it's official. It's $966,297, and that's from HRSA. HRSA is the Health Resources and Services Administration at a federal level. And this grant truly is to talk about COVID outreach and community health workers, and to really bring pop-up vaccination sites to think about how we're going to be doing boosters and how people have to continue to be educated on getting this done. So it's not just city monies, but it's city monies. The majority of it will go to city employees that we have to hire. We have to hire 4 community health workers. We're also going to work with the Board of Health and hire a public health nurse and hire a pharmacist. That the pharmacist will be responsible for giving the vaccination along with the nurse, and the nurse will coordinate what's happening with the all the behind the scenes that if you're not involved with vaccinations, there is a lot of behind the scenes when data entry and making sure that everybody has the right information and names and date of births and so on and so forth. So we'll be working with them. We'll also be working with community partners, nonprofit community partners, Groundwork Lawrence Community Works, the Lawrence Partnership, along with Northern Essex Community College, who will be partnering with us to really work with their community health workers, the students that go to their programs, to see if we could hire students from there to get trained. And hopefully this is something that we really long-term saw a need for as we saw what was going on with COVID. And then we have incentives for the pop-up clinics. And we also have a little bit of money put aside to try to incentivize churches to come on board with us to really push the vaccination, but not just to give an incentive to put a pop-up, but to really help us get people vaccinated. So, you know, there's a lot. I will be the project leader, and we will be having many organizational meetings. And if anybody's ever known of getting federal monies, there is a lot of reporting that goes on, and there's a lot of data that has to be put into their database. I'll open the floors if you have any questions or if you would like to ask me anything.
All right, councilors, we have Marta Velez here in front of us with item 16921, the $1 million to be used for tracing and hiring new people. If there is any questions for Marta?
Make a motion to send this up to the full council with a favorable recommendation.
There is a motion on the table.
Second with discussion.
It's properly second discussion, Councilor Payano.
Martha, would you be able to give us at some point sort of a more, I would say like a not crazy amount of detail, but just for
Like an overview?
Yeah, so we're aware, like, it's $1 million. So like how much is being spent on wages? How much is being spent on other things that you're doing? I mean, I'm guessing that a good chunk of it will probably be wages, unless you're
So
saying that.
I could tell you that right now, $501,102 will be for wages and benefits. And $391,574 will be for supplies, contractual contracts, and other like incentives and stuff like that. And then there's the indirect cost.
I'm sorry, I missed the last part you said. You said 300. Can you just repeat that?
$391,
21,000.
574.
Okay.
391,000, correct?
574.
Great. If possible, if you can just email us those figures, that'd be great. I think I want to make sure that that information is attached to this record, so that way it is clear. Anybody that wants to look it up knows exactly how this money is going to be divided up.
Sure.
Thank
I
you.
can do that. I could also give you an output measures and what our objectives are and how it breaks down in a year.
Perfect.
So there's benchmarks that we have to meet every month, 2 months. We have to report every month. So for those people that do not understand, when you get federal monies, there's a lot of attachments to it. There's a lot of reporting and a lot of things that have to go on.
Agreed.
So I will be more than happy to do that.
Thank you. Mr. Chair, no further questions.
I have a question, Mr. Chairman. Hello.
Yes,
So
Councilor Levy.
Yes, I would like to know for how long is that is the grant?
It's a 1-year grant until June 30th of 2022.
Okay.
So, councilors, as of right now, we are on month 9. We have about 9 months to spend $1 million.
Yeah, and they understand, because I did have a meeting with them because they did. I mean, this was supposed to start July 1st, and they let us know July 27th or July 30th. So, I mean, I did have a meeting with them, and I explained the process of the city that I needed to go before I start hiring or doing any of that. What I would ask that when we go before the full council, if we could waive the 30 days that we have to waive when we have the vote, because I do need to move on this.
All right. Councilor, there is any other questions in regard to this item? All right, I move the question. Councilor Payano.
yes.
Councilor Abdo.
Yes.
Councilor Levy.
Yes.
And I vote yes. Councilors, we have item 15221, which is order to spend grant of coronavirus local fiscal recovery funds. It's for $57,351,845. It was put together by Mark Ianello. I believe that they are not here. Councilors, do you would like to open the discussion at this level as of what we need in a clear basis, and to send correspondence again if it's need to the administration? So can I get a motion to take this item out, 150 to 21?
I'll make a motion to take item number 15221 off the table.
Can I get a second? Councilors, you don't want to discuss this? All
Chair,
right, it died for the lack of second.
yeah,
All right, I guess that we're gonna have to move forward at the full council then. All right, can I hear a motion to adjourn?
Motion to adjourn.
second.
All
We're
right.
going to talk about the Mayor's Health Task Force.
Oh, so hold on. Yes, do you have the person here?
No, but she did send me, I did ask her.
Okay.
She's on vacation, actually.
All right, councilors, can we actually
Withdraw the
proceed the
motion.
motion to adjourn?
I withdraw my second. I don't know if you need
Alright.
the original sponsor, which is Councilor
Alright.
Levy.
All right, it died because of lack of second. So let's go back to item 18921, which is ordered to spend grant funds for $50,000. And we have Marta Velez, which is
I'm-
going to discuss and speak about that $50,000.
I don't
Excuse
have,
me, Mr. Rodriguez, you taking that out of table?
Yes, can I get a motion to take it out of table matters?
So moved.
Second.
All right, I said there is a motion on the table to take item 18921 out of table. It's probably second. I call the questions. Councilor Payano,
Yes.
Councilor Abdu,
Yes.
Councilor Levy,
Yes.
and I vote yes. So item 18921 is out of table. Marta, you have the floor. Can you explain to us
Yes, I can
importance of that $50,000?
sure, I could give you the information I have. I would request, please, respectfully request that we take a motion to bring it to full council, and then I'll make sure that Alicia Miller is before you at the full council meeting. But what I asked was, is this for the continual work that we've been doing under food insecurities and food deserts? We did a survey, and because of, and this is exactly what she put, Department of Public Health recognizes that many of us worked with our fellow public health counterparts on COVID issues in our communities, and that our progress was significantly hampered. So what they've done is they extended one more year. They've granted us a year extension to complete our work. So it is to continue doing the food insecurities and food surveys that were done and that need to be evaluated to continue to do the work that we're doing. But she could be before you at a full council so that she can answer more questions if you have.
Councilor, there is any questions in regard to this item? There's no questions. Can you hear a motion?
Motion to send it to the full council with favorable recommendation.
Second.
All right, there is a motion on the table, properly second, to send it to full council with a favorable recommendation. I call the questions if there is no questions on this. Councilor Payano,
Yes.
Councilor Abdul,
Yes.
Councilor Levy,
Yes.
and I vote yes. There is any other item out of table matter that we would like to take up? There is none. Can I hear a motion to adjourn?
Motion to
Motion to
adjourn.
adjourn.
Second.
There is a motion to adjourn on the table, properly second. I call the questions. Councilor Payano,
Yes.
Councilor Abdul,
Yes.
Councilor Levy,
Yes.
and I vote yes. Thank you so much, everybody.
Thank you. Have a good night.
Bye.
Thank you. Night.
Good night. Bye.